Good afternoon. Welcome to our webinar today. My name is Terry Malenfant, and I'm the moderator of this live panel discussion about Genetworks Laboratories and the company's innovative Safety for Employers and Schools program. Safety is an all-in-one platform and program developed to help employers and schools conduct repeated or sequential COVID-19 testing of an organization's workforce in order to ensure the safety and health of individuals as they go back to work and school. At this point in time, we are very much still embroiled in the worldwide COVID-19 pandemic. As the virus continues to spread and the pandemic continues, our panelists will provide important information such as how can organizations and schools ensure that frontline workers, faculty, students, or healthcare professionals are able to work and study safely. Also today, our panelists will talk about how employers can implement an oversight and monitoring program to keep their businesses running, keep residents or employees safe, or keep campuses open safely. At the end of this webinar, you will know what is needed to put a comprehensive testing and monitoring plan in place for COVID-19 suppression in your organization. And you will learn how Genetworks can partner with you to make it successful. This discussion is hosted by Genetworks Laboratories, which is a CLIA and CAP certified laboratory and FDA authorized provider of COVID-19 diagnostic and antibody testing. I'd like to start today by introducing my distinguished panelists. Sarah Jacobs-Helber, PhD, is the Chief Laboratory Officer at Genetworks. Sarah has more than 20 years of experience in laboratory management and molecular testing. She is board certified by the American Board of Bioanalysis as a high complexity laboratory director and is also certified as a director for molecular genetics and parentage testing from the New York State Department of Health. Welcome, Dr. Helber.
Thank you.
Stephen Palucci is our next panelist. Steve is the chief architect and team lead on the ARA software that powers the COVID-19 sequential testing and certification platform, which you will be learning about. Steve has spent the last few years developing AI and tech-driven recruiting platforms. One of Steve's projects includes developing software for an employee performance appraisal system for the Office of Management and Budget at the White House. Welcome, Steve.
Thank you. Pleasure to be here.
Next, we have Dr. John Hopkins, who is the president and founder of CCS Healthcare, a medical practice that develops and staffs on-site primary care and telehealth programs in senior living facilities. Dr. Hopkins practiced medicine throughout the United States to better understand the variance of healthcare disparities driven by socioeconomic status. He also spent time overseas evaluating the pragmatic application of a public healthcare system. Now, CCS is currently doing 1,000 COVID-19 tests a day through Genetworks, and we welcome Dr. Hopkins to this panel.
Thanks for having me.
Finally, Matt Etheridge is Vice President of Sales and Marketing for the East at Genetworks. Matt has more than 18 years of experience in sales and leadership positions in the medical marketing field, including pharmaceutical, medical device, biologic, and laboratory spaces. Matt joined Genetworks in early 2020 to lead the company's expansion into COVID-19 testing. Welcome to you, Matt, and thank you all for being a part of this panel discussion. Matt, if I could turn to you first. As America goes back to work and organizations need to create a program to protect their employees' health, can you tell us about the new Genetworks testing and oversight program for the COVID-19 virus that has been developed for employers and schools?
Sure. First of all, thanks so much, Terry, for hosting. And thank you to all of the folks that are joining us today. We really appreciate you taking the time out of your busy schedules. We know, like us, you're probably busier than you've ever been, and you're looking for answers. And it's probably the most challenging time that you've ever dealt with, regardless of what profession you're in. So thank you for taking the time to be with us. And look, what we understand is that, you're watching the news every day and you're seeing the numbers. And whether you're an executive director at a long-term care facility, maybe you're an employer, looking to get your staff back to work and to get them ultimately productive when they are back at work. Whether you're your university trying to get folks back to campus because you know that these young adults, they need this normalcy back, or maybe you're just a single mom who's going, holy smokes, I have to go to work. You know, the virtual learning is great, but I need my child at work because I have to earn a paycheck. There's so many layers to this COVID-19 issue, whether you're talking about physical health, mental health, economic health, and we just want to salute the work that you all are doing. And we know how difficult it is, but we're there to fight with you. So what we try to do at GenetWorks is develop a comprehensive program, a program that's been based on feedback. So taking our customers, taking prospective customers and saying, what do you need? Because the overwhelming response that we get is testing is great, but we need more. We need a solution. So what GenetWorks has really worked on is getting an overall solution that allows, whether you're an employer or a university or maybe an assisted living facility, to test people, whether it's a one-time or whether it's sequential testing, but also to do a great job from a population monitoring standpoint, to do a great job to not only empower the provider and the doctor and the administrators, but also the patients with their information, so we can limit the spread of COVID-19 as much as humanly possible.
Thanks, Pat. Can you speak to how GenetWorks can help organizations that want to implement this type of program? In other words, how do organizations get started on a testing program?
Well, the key is, the thing that we hope that you know about us is, listen, there are a lot of great labs out there. We have immense respect for our partners in the industry. We're all about service. So we don't give you a 1-800 number, and we're not dropping off a pallet truck with tests, right? That's not how our process works. We want to work with you hand in hand to get you set up, make you informed, and then walk you through every step of the process. So the process works like this. You reach out to GenetWorks, you let us know that you want to partner. At that time, we'll get you some information, so therefore you can set up an account. That typically takes about 24 to 48 hours to do that process with our IT system. As soon as that's done, we get your test kits sent out. And then what your representative will do is really work with you to educate you on how to order, right? How to view results, all the things that you need to know so you feel really comfortable and the folks that you're going to serve feel super comfortable with working with our laboratory. That's the most important thing that you know from a service standpoint. We're there with you every step of the way.
Thanks, Pat. Dr. Hopkins, if I could turn to you and the public policy area, can you explain for our audience what sequential testing and sequential population management means in the context of this pandemic?
Sure, and thanks for having me again. So just before I answer that question, just want to give the folks a little bit of background on what I've done over the past 4 months, as we've all learned very quickly about this new disease and this new illness. Since March, we've been working with long-term care facilities to try and really contain viral spread through New York, New Jersey, and Pennsylvania, and have learned a lot along the way. And unfortunately, what we know now is that there is no cure for this disease. We don't have it, and there's no vaccine. So the only defense that we really have for our at-risk populations is testing, and even to go further, sequential testing. So sequential testing is identifying asymptomatic carriers of the disease that can be a threat to the spread of the disease. And the only way to do that really is through a very robust, repetitive molecular testing system and data management. So you gotta believe that this disease is real, understand the tools that we have, or the tool that we have to fight the disease is testing, and then implement a sequential testing program to protect your employees or the at-risk populations that you serve. On the back end, when you get the results of those tests, you need to have a data management system to support the individuals that you are testing and to guide the communities or employers that are doing the testing to make informed decisions based on the results.
Can you explain for our audience how CCS has actually been utilizing the GenetWorks testing during the pandemic?
Absolutely. Just like everybody else, this was a learn as you go type of operation, going from a private practice that services long-term care communities into a population health management really company that is trying to guide them from an infectious disease perspective. We had partnered with several labs in the past, and what we found is a lot of that data management, that customer service element, the responsiveness of the other organizations, I think they were a bit overwhelmed by the volume. And what we found with Genetworks is we get consistent response. Their data management platform is the one that we like the best across the board. They're now our preferred partner. It is very easy to navigate the data management. And the other side of this is their responsiveness when things go wrong or we need to pivot. They're right there with you, within 24 to 48 hours to get things changed and get you the equipment you need, the lab equipment, the results that you need. They're very customer service focused, which helps a great deal in this process.
That's great to hear. Steve, I understand that you developed the Aura software and app for the Genetworks safety testing and monitoring program. If you could, can you provide some of the highlights of the software and explain how it works? Steve, I think you're muted.
Am I muted?
Oh, now you're up.
Oh, okay. Can you hear me?
Yes, we can.
Okay, great. Okay, so Aura establishes a program of sequential testing and certification for all your people. Initially, we establish the testing frequency for your organization, and that can vary according to your job. You might be a health worker and require testing every 3 days. You might be a student that needs to be tested every 7 days. Some of the highlights, first of all, it's easy. We can preload users provided by the organization and provide them with logins. So the user logs in, immediately finds the closest location to them and the soonest dates that they can test. They can enter insurance information. They schedule their test. They get a calendar invite. They get reminders on the day of. Then they show up. The sample is collected. We track these shipments via UPS and FedEx, so we know where that sample is at any point during its journey. And then a day or so passes and clear results are then rapidly delivered to the application. And they'll get an email that says, hey, your results are ready, check out your results in the app. And they will also get a push notification to the app. If there's a negative result, no COVID, they get a QR access code. Otherwise, it's into quarantine. That QR code grants them access to the various perimeters established for your organization. And we provide scanners that you can use at various entry points. Aura also has daily self-health checkup functionality. Every morning, with their cup of coffee or their smoothie or breakfast, the user will get a health check reminder saying, hey, how do you feel today? And they can check off the symptoms that they are experiencing, if any at all. Fever, headache, loss of smell. And this will provide an alert to your organization, to HR, which will help identify risk and whether or not the user needs to be counseled to be tested immediately. We also have location tracking capabilities. So we can geolocate users. Typically every 10 minutes, we take a geo timestamp, and this is just one of the features we have. And if someone's positive, we can track their whereabouts we keep that for up to 3 weeks. And then we can cross-reference any of the people who they came into contact with. All of this rolls up into a dashboard for the organization so they know exactly the status of each and every individual, that they're in compliance, that they're healthy, and that they can operate with confidence. And company facilities that establish these protocols will be recognized as Genetworks certified, the gold standard for COVID-19 testing for businesses and other organizations.
Wow. So overall, what are the benefits of the Aura software for employers and employees? And is it truly user-friendly?
It is truly user-friendly. When COVID-19 hit, we made it our mission to get our children back to school and to get people back to work and life back to the new and confident normal. But the most important thing was to make it easy. I mean, we've seen a lot of headaches and people having trouble out there in the field, and we just wanted to provide a solution and remedy that for everyone. And Aura is the glue that ties together finding those testing locations easily, scheduling, performing the test, tracking shipping, getting clear and rapid results to the users that need them the second we have them, and provide that comprehensive reporting to schools and organizations, long-term healthcare facilities, so that they can secure their perimeters and know that their workplace is safe, and that employees know that they're safe and their coworkers are safe and that they can operate with confidence. Employers get a total view into the status of their organization's health through the various reports, who's tested, who's positive, who's missed their test, and variances. But I mean, it's easy, really. What makes it the most easy is it just guides the user every step of the way. Where do they stand in the process? What is the next step? How do they proceed? Where's the closest location? What do I do when I get there? It just provides in-depth instructions. And I think that a lot of people out there, when they feel they need to test, they just don't know. And we're giving them those steps. And one of the best things, and that makes this very user-friendly, is we eliminate paper completely. A lot of times we've seen labels that are handwritten, they get back to the lab and they have to be entered into the system manually and all this. Our users are pre-registered, so they can download the app at home, at their convenience, put in their insurance information. We've got all the providers, so we'll do a quick lookup. And they're ready to go as soon as they get to the facility. I mean, we have everything we need. All they need to do is get in line. And by the way, the scheduling, we track volume and capacity at the different locations. So we can see if every 10 minutes we can schedule, say, 15 people, and we just keep those lines moving. So you're not standing for a long time waiting. And there's no paper. They're checking off and signing their HIPAA release forms. Their insurance is in there. Everything is HIPAA compliant. Everything is heavily encrypted and filled out before they get there. All of this data basically tells a story, and we can take these symptoms and we can feed those into machine learning models, run regressions, and see how we can correlate symptoms with the test results. But I mean, it just makes it easy for everybody to stick to their schedule, to follow the routine. It lets people know what to do, and it really helps. Aura helps track that sequential testing result, providing dashboards, accurate reporting, important health data reflecting the COVID-19 status of the entire population, maintaining compliance with all government regulations, even as they evolve over time.
Great, thanks, Steve. That's quite an application. Sarah, if I could turn to the testing itself and your expertise right now, can you explain what the differences are? We'll start basic between the COVID-19 diagnostic and the COVID-19 antibody test.
Yes, thank you, Terry. It's a pleasure to be here. So Genetworks currently runs two different types of COVID-19 tests. We run a diagnostic PCR test and an antibody, what's known as a serology test for the detection of COVID-19 antibodies. So the diagnostic test is an assay for the detection of the active virus and current COVID-19 infection in a person. So it tells you, at the moment of collection, does the patient have a COVID-19 infection? The sample type that we use is a nasopharyngeal swab. We also have it validated for mid-turbinate collection, so it's not quite as invasive as the full nasopharyngeal collection. And that swab is used to pick up the virus in the nasal cavity, and it's placed into a stable buffer and transported to the laboratory overnight for testing. In the laboratory, the sample is, the viral RNA is removed from the specimen, and our laboratory then uses the same primer and probe sequences that were developed by the CDC for the detection of the COVID-19 virus. And however, we have adapted it from use for just 100 samples at a time to be able to do it in a high throughput format for thousands of samples at a time. So the antibody test, by contrast, is used to determine if the patient has previously been exposed to the virus. So it looks more into the past. Has the person been previously infected with the virus? Rather than a nasal swab, a blood sample is taken, and the presence of the antibody is detected using our EUA authorized antibody detection method.
All right, can you explain about the accuracy level of these tests, of both GeneTworks tests, and perhaps provide some detail on why the GeneTworks tests actually surpass many other laboratory tests in terms of accuracy?
Yes, I'll be glad to. So both of the tests that we've done have been validated using guidelines from both the FDA, EUA templates, and our accreditation agency, the College of American Pathologists. The PCR test is one of the most sensitive on the market. Our assay can detect as little as 10 copies of viral particles in each specific test. And the antibody test is far superior to what a lot of the rapid tests that are out there, because it's validated on a chemistry instrument that's got a proven track record and that we've been working with for years. So rather than a finger prick that is used to detect something at a, that'll basically give you no more than a coin flip on something that's been developed over the last couple of months, the test that we have is a blood draw that's done by a phlebotomist, so a trained phlebotomist, so you know you're getting a good sample, and then it's transported to the laboratory and tested using the our high throughput instrument, and within 24 hours we have results of whether the person has actually been previously infected with the coronavirus.
In terms of the antibody test, Sarah, you mentioned that it was in the 99th percentile for accuracy. Can you specify what a positive and negative means for individuals taking this test?
So for the PCR-based test, a negative test means that at the time of your collection, you have not been exposed to the virus. You do not have the presence of the virus in your nasal cavity. A positive result on the PCR test indicates that you are in the midst of a COVID-19 infection. It's a moment in time test, so it doesn't really tell you whether you're at the beginning, in the middle, or at the end of the infection. For the antibody test, if you are negative, it means that you either are not now, nor have you previously been infected with the COVID-19 virus. The nature of our test is if you are positive for the antibody, it means that you either are in the midst of an antibody or of a COVID-19 infection and are infected and are creating the antibodies that are used to fight an active infection. Those are called IgM. It also detects IgG, which is the gatekeeper for reinfection. So it detects both of those antibodies, and it detects them at a 99% accuracy level. And our PCR test, again, has a very, very low limit of detection and has over a 99% accuracy rate for the detection of the presence or absence of the virus.
Thanks, Sarah. With regard to the antibody test, one more follow-up question for Dr. Hopkins or Sarah. Can you provide your expertise on the limitations with even the most precise antibody tests, such as GenetWorks, in terms of determining whether a person has immunity from the virus or has had the COVID-19 virus?
Oh, I'd be happy to. I think the antibody test itself, from a GenetWorks perspective, is validated and highly accurate. Antibody tests in the field can be very variable. So a number of antibody tests were actually removed from FDA emergency use authorization due to the speed at which they came to market. But when there was attempts to validate their results, they failed to be validated. And it's my understanding that they were then removed from the marketplace. However, antibodies in general, folks have to be very cautious with how they use that information. The molecular PCR, whether you have an accurate or an active infection, is the most important test. The antibody tests are really confirmatory to a disease, infection, or infectious process. It's a rear view mirror test. You're looking back to see, did somebody potentially have the disease at some time? Not, do they have active COVID-19 infection now? And that needs to be understood very clearly. That's where I've seen a lot of programs falling short. Additionally, information's coming out about COVID-19 that some of us don't have significant enough infection to even generate IgG or IgM antibodies to the disease, and that our T cells, which is another type of cell that fights infection, might be the tool that decreases the infectious response in our body, and we don't create IgG or IgM at all. So this is a very complicated topic, and you need to have professionals interpreting your data. Right now, the gold standard is that nasal swab, that molecular PCR to safeguard your populations. The antibody tests are still, although highly accurate after an active infection, the amount of information that you can draw from that is limited.
So in the case of the COVID-19 diagnostic test, in contrast to the antibody test, the results are conclusive. A positive means you have it?
Yes, that's correct. That's correct. It means that the time that your sample was taken, that you had the viral particles in your nasal cavity. So that is active infection. However, just remember that there are also people who have the virus and don't have any symptoms. And that's why the sequential testing is so important, because it's important to be able to detect the virus before somebody gets out into the population or back into the workforce to spread that infection, even if they don't know that they are.
Matt, I know every lab in America is struggling to provide enough of these tests, this testing capacity for this overwhelming pandemic. I'm told that GenetWorks is adding capacity each week for all those GenetWorks patients who are getting tested at various sites around the country. How are they being notified of their results?
Yeah. So first of all, let me first address the need to continue to grow capacity, and that's a very important issue. And unfortunately, as you may or may not know, there's no book that describes how to take a business from doing 1,000 specimens a day to 20,000, which is how many we got in yesterday. There's no manual for that, right? So what I can tell you that Sarah and her team have done an excellent job of doing is just saying, listen, what can we do to get better? What equipment do we need? What automation do we need? How do we need to invest in people? And it's been an open checkbook from the organization to make sure that we have everything we need to continue to ramp capacity to serve the demand that is coming in from the public. So that's very important. I know there are other labs out there, again, great labs, but they're holding serve where they are. They feel like, listen, providing COVID-19 testing, I'm sure Sarah would agree, very challenging and very difficult and very stressful for everyone involved in the organization. But we've made the decision organizationally that we're going to push forward and we're going to be able to offer this test to as many people as possible. And we are not going to stop increasing our capacity week over week. So that's number one. I wanted to address that up front. Number two, and how the patients get their results. Well, there's several ways. Number one, Steve went through the Aura application, which is just fantastic, where patients can get that via QR code on their cell phone. But even if they're not using the Aura application, that information is sent to the provider or the HR program at an employer, whichever the customer so chooses. So it can go directly to the provider or to that employer or to that university. But we also have several metrics that have empowered patients to be able to get their own information in real time as well, including a web-based patient portal platform, as well as a texting application that will send a text message to patients that will allow them to go and authenticate themselves in a HIPAA secure portal by their last name and their date of birth, where they can view their results. And also we have a customer service line where they can call in for their results. So we found it very important early in the stage. It's important that the physician or the ordering provider gets that information, but we also want to empower patients and get that information into their hands as quickly as possible, because a lot of times, especially if you're being tested and you need to go back to work, you need that information from your doctor. If you go to a traditional laboratory, they say, well, we can get you your report, come pick it up on Monday. And if it's Friday and you need to work a shift on Saturday, you need to be able to take that to your employer and show that you had a negative test. So we really wanted to step up here and provide some unique solutions that would allow patients to have that kind of access to the information.
Thanks, Matt. Can you tell us what type of organizations currently around the country are using the Genetworks lab tests?
Sure. I mean, it's really across the board, from your regular internal medicine or primary care type clinics. We get a lot of business from pre-surgical customers that are mandated by states to test patients prior to surgery. We work with a lot of hospital systems, as well as folks that have drive-through set up, assisted living and long-term care type facilities, universities, employers. If you can name it, we're food services as well, meat packing. If you can name it, we probably have worked with them in the last 13 weeks.
That's great. Well, that was the last question for this portion of the program, but we're not done yet. I'd like to read some questions from our viewers now for our panelists. The first question is for Steve. Is the Aura app SOC-2 compliant?
It is HIPAA compliant and follows all SOC 2 guidelines. We've gone through very comprehensive testing, penetration testing. We have security policies in place. We have vulnerability scans, static code analysis, and all of that. We are working towards SOC 2.
Great, thanks, Steve. Waiting for my next question, which I don't have yet, and I know there's a lot of you viewers out there. Okay. Well, until I get it, I'm going to ask this follow-up question, which I know we talked about before. Dr. Hopkins and Matt, are you seeing any difficulties on the part of organizations in conducting their own testing, specifically the swabbing of employees?
Dr. Hopkins, I think you would be great to answer that question.
Sure. No, absolutely. It's been a significant challenge, to be honest with you. So having access to the testing is certainly one thing. And having access to results in a timely fashion is another thing. But how do you actually execute the test? How do you then manage those results? And that's where an organization like CCS Healthcare really comes in and does all of that, and is a strong partner with Genetworks to make that happen. We've been working with several long-term care facilities. We're working in about 100 per week, doing about 1,000 tests per day, where we actually deploy the staff to do the testing on their staff and residents, and then collect those results. We then pass off the baton to Genetworks to run the tests and give us all the data to evaluate, and then we counsel the organizations that we serve on those results, back to work policies, quarantine strategies for active infections. So it certainly is a two-step process. And number one is getting the tests, getting the material to perform the test, but there is a lot of heavy lifting involved in actually performing the test and doing it in an efficient way, with a team that has the expertise to do it the right way. And we've been assisting organizations in that process for about 3 months now.
Thank you. And I think, Matt, does Genetworks have a video that helps explain the process?
Absolutely. Yeah, we definitely, when part of the onboarding process is really walking through customers, and I mentioned earlier about getting them comfortable. That's part of the process. But what we've done is we've tried to really think outside the box and think about, questions that come up. So we do have instructional videos on, the collection process, on making sure, just for example, this is everyone is in such a hurry, and Sarah would agree with this. She sees this every day. Everyone is in such a hurry that sometimes mistakes get made. So a perfect example is they don't screw on the cap tight enough, or they don't label the specimen. They don't write any identifiers or put a label on the tube. It happens every day from great folks who are trying to do an awesome job. It's just everyone is in a hurry and mistakes get made. So we really spend a lot of time on the front side with accounts, trying to educate them on the process so they have as few mistakes as humanly possible.
Thank you. Okay, the next question from our audience out there is, for patients, this is concerning the antibody test, for patients that have formed antibodies, can their plasma, be used for treatment? So I guess that would be Dr. Hopkins.
Sure. Yeah, you probably have heard of convalescent plasma treatment in the severely ill patients, maybe through the news, or through folks who have been treated with this remedy. And it certainly is plausible. If you do have antibodies, I would encourage you to contact your local hospital. Because folks that are in the intensive care unit that are on a steady decline, since we don't really have a cure and we don't really know as a medical community, we're trying everything we can to save their life. And the use of convalescent plasma, or plasma from a donor that have developed antibodies to the disease, is one method of treatment being utilized across the country.
Thank you, Doctor. The next question is, I guess, for Matt or Sarah. What is your data security policy? Or it could be for Steve as well.
I could talk about our data security policy. Everything, our data is completely encrypted and de-identified. It's in the cloud. So we keep results in a separate database de-identified from the actual patients. So if there ever was some kind of compromise, you wouldn't be able to make sense of any of these results. We do key management, intrusion detection. We do periodic vulnerability scans. We do everything possible to keep that data secure. And we have various policies in place to support that.
Great. The next question we have is about turnaround time. What type of turnaround time is offered from time test is taken? And this person is from Manhattan.
Yep. So I think that is evolving. So if you were to ask Sarah and I a couple weeks ago, for about 6 weeks, we resulted almost everything within 24 hours of when we got it. What we have seen in the last 10 to 14 days is an unprecedented spike in volume, and it's happening all over the country. It's not just Genetworks. I've read, LabCorp and Quest press releases. I mean, it's just a fact of the reality that folks are overwhelmed. We're doing everything we can to deliver the kind of turnaround times that we've been accustomed to. At present, I think we're a little bit further out than we like. I think that we're going to settle in at about 2 to 3 days post receipt, I think is a fair assessment. But everyone is doing everything they can to ramp as fast as possible. We hired, I believe, 100 new people in the last 10 days and are in the process of training those folks. So it's a monumental effort that's being undertaken by the lab staff. And our goal is to make those results as fast as humanly possible.
Great, thanks, Matt. The next question is, do you have any peer-reviewed papers on the test sensitivity and specificity? And I'm going to give this second one, sorry. Does Genetwork do a cross match for blood type? I figured they could address.
Yeah, I can answer those questions. The first answer is that the way that the FDA and the EUA works is that we performed our validation per our laboratory accreditation, and then it was submitted to the FDA for their review. They reviewed the data and found that our modified method of the CDC assay was acceptable per the EUA guidelines and per our accreditation agency, and we were authorized to use it. We have not we have not published any peer-reviewed articles about our testing right now. As you can imagine, we're in the throes of getting our patients served, and it would be a great goal to do that. Right, as of right now, we haven't done that. The second question, can you say it again? I forget.
Sure. It's does Genetworks do a cross match for blood type?
As of right now, we do not do blood. We do not have that as part of our panel. It's something that we're looking on probably to bring on sometime later in the summer or in the fall. But we understand the importance of that.
Thanks, Sarah. The next one is long-term. How do we plan on integrating our data management system with employers and healthcare providers' current management systems? I imagine that's you, Steve.
Could you repeat the question? Sorry.
Absolutely. Long-term, how do we plan on integrating our data management system with employers and healthcare providers' current management systems?
Okay, so we work with a lot of many different systems, and our team is continuously doing integrations with organizations' data management systems. We have APIs that we use. We also do things like data exports, XML, CSV export to, if you have an SFTP site, but we have various ways of working with your organization, and we are very willing to work on integrations.
Great. We have one more question, which is, how does an organization engage with your firm? How do we contact? I think that's you, Matt.
Goodness, I'm going to give out my cell phone number, and I may get blown up the rest of the day, but that's okay. So you can reach out to me directly. My cell phone number is area code 478-718-7497. You can also go to the Genetworks website, and there is a questionnaire that you can fill out there that gives us really good information about your organization, who you are, how many folks you're looking to test. That may be the best way. I should have probably said that one first. Anyway, you can definitely go to the website and fill out the online questionnaire, and it really gives us a good idea of exactly what you need prior to us calling you. And we'll reach out directly to you. That way, we can be prepared to discuss exactly what you need.
Great. Thanks, Matt. Does any of our panelists have anything more that they would like to add to this wonderful discussion? No? All right. Well, I'd like to thank you all of you panel members for sharing your expertise about sequential testing and monitoring for employers, and how this can help ensure CDC compliance and a safe workforce as we all move forward through this pandemic and return to work and school. Thanks also to those of you participating and watching this and taking the time to learn about Genetworks and safety program. If you are interested, I know Matt did give you some information, but you can also go on genetworks.com and contact us. So in the meantime, thanks again for being with us today, and please stay safe out there. Thank you.